Hello, good morning. Today we are going to discuss something about the care of the preschool children and under 5 clinic. As you see, the title is Doing Somersault, as well as the preschool children also do the same thing. They are restless, they are very active, they are not teachable and all. That's why they are more important stage of the life. You see, this age group, they are very naughty. They try to reach everything. They try to do everything. They are very curious of the things, how the things happen, how the things are appearing, why the objects are moving, and all. They are very curious and they are lacking of experience of anything. That's why they touch everything. And they may hurt themselves. That's why this group is very important to study. Today we are going to study the care of the preschool children and under 5 clinics. Preschool children means they belong to 1 to 4 years age group. They are also called toddlers because below 1 year they are called as infants. Infants are not movable and we can do all services, we can give all services because they will be confined to one place. But after 1 year, they start running here and there, crawling here and there, jumping and all. Due to all these activities, they are very difficult to reach. In developing countries, the social and health needs are realized very lately. Today, the organized medical services and welfare activities are concentrating upon their welfare because they are the future generation and their health is of our concern. They are recognized by the large number to the extent of 9.7% of the general population in India. 1 to 4 years age group belong to this much of population, 9.7% of the general population in India. Nation's development depend on them, but they are less attended because this group it was being less attended. Now they are concentrating more upon this age group. The mortality, by mortality also they are recognized about 2.3% of all deaths occur in this age group. They are very much vulnerable for infections and malnutrition. Morbidity, the disease pattern also is very much high in this age group. Not only that, the diseases or infections, whatever affect this age group, not only they retard their growth and development, resulting in malnutrition. Malnutrition again gives rise to and invites infections. The infections again aggravate the malnutrition. So that's how the vicious circle occurs. So they are the victims of protein energy malnutrition in 5 to 6% of the cases, retarded growth and development due to malnutrition and infections. Infections like acute diarrheal diseases, diphtheria, tetanus, whooping cough, measles, eruptive fevers, all these things are more in preschool children. 25 to 30% of the child's life is affected by infections. So the more number of infections they are exposed, more episodes they are exposed, their growth and development will be impaired. And loss of weight will be clinically seen. Common disorders in this period are anemia, xerophthalmia, that is dryness of the conjunctiva of the eye. Skin and eye infections are very common. Parasitic infestations are also common because they put their hand into the mouth very often. Accidents are also common. Accidents like burns, falls, injuries are very common. They are prone to chronic diseases which will have some adverse effect in the adult life, like heart diseases or mental retardation. Growth and development in preschool children. This is the very vital period in which the growth of the brain is maximum. Up to 5 to 6 years, the growth of the brain will reach optimal stage. After that, one has to utilize the capabilities of the brain. Any adverse influences in this 5 to 6 years, the first 5 to 6 years, will give rise to malnutrition and infections, which lead to retardation of the growth and impediment in the development, cognitive skills and all, and some diseases are irreversible. The preventive care and special action are required to meet the biological and psychological needs for growth and development. So this is the period where we have to take special action, not merely some superficial care. We have to specific action we have to take so that their biological and psychological needs are met. Accessibility. In this age group, unlike infants, toddlers are difficult to reach and very difficult to look after them. So special inputs are needed to bring them into the orbit of healthcare. For example, daycare centers, playgroup centers, children clubs are established to keep them in one place and train them properly. Child care to prevent the health problems in adult. Whatever the problems occur during this period, they will have some influence or very adverse effect in the adult life. For example, see children's nutrition and infections. So early action if you take, we can prevent certain things like dental diseases. The dental caries is more common through the bad oral hygiene. Some heart diseases are likely to occur. If we take early action, heart diseases can be prevented. Streptococcal infection, hemolytic streptococcal infection with some autoimmune reaction and all, to give rise to rheumatic heart disease. Rheumatic heart disease starts with the sore throat, with the streptococcal infections will be very rampant and they give rise to some autoimmune reaction and affect the joint. It hits the joints and bites the heart. So rheumatic heart diseases are very common in adult life due to the infection of the streptococci in the childhood. So that can be attended and rheumatic heart disease can be prevented in adult life. Just like that, certain risk factors of the non-communicable diseases, they take seeds, they grow they sprout in the childhood. For example, the obesity and overweight and all they give rise to hypertension, diabetes, and cardiovascular diseases and mental disorders. Whatever the cholesterol consumption they take in this period, the preschool age period, they will remain for lifelong. Obesity will also grow. The hypertension, the arteries will be narrowed. So they will develop hypertension, diabetes, cardiovascular disease, and mental disorders in the adulthood. So uncorrected orthopedic defects, some congenital defects may occur during childhood, like telepathic virus, the deformity of the foot, and congenital dislocation of the hip. They occur as a congenital deformities during birth. If they are not corrected, the child grows and faces the major problems in the adult life. They are vulnerable for certain social and health hazards, so special care is always needed. So what are the child health problems? So these are the child health problems. One is low birth weight, malnutrition, infections and parasitosis, accidents and poisoning, behavioral problems. The last time we have discussed in detail the low birth weight. In India, 20 to 30% of all live births are of low birth weight. More than 50% of the world's children were underweight for their age. 80% of the infants of low birth weight died due to infections because of the low birth weight and low immunity system. They are susceptible for the infections, and infections they overhelp and kill the children. 35% of the Indians under 5 children are underweight. 35% of the Indian children under 5 are underweight. Of them, 7.5% are moderate to severe wasting. 8.4% suffer from moderate to severe stunting. You know, stunting means less weight for the age. And malnutrition is the second most common problem in the preschool children. It is the underlying factor in 45% of the deaths among under 5s due to scarcity of the food, lack of purchasing power, traditional beliefs and taboos. Food may be lacking in the family due to various causes, low income, low socioeconomic conditions. If the food is there, what type of food should be given? That ignorance is also one of the factors, and lack of purchasing power, traditional beliefs and taboos. So food fats are there. Parents don't want to feed certain foods. They don't know the importance of the foods. That's why they give something which is not very nutritional, which is not helpful for the growth and development of the child. So malnutrition will lead to susceptibility of the infections, and there will be slow recovery and mortality will be higher. Undernourished don't grow to their full potential of physical and mental abilities. Their cognitive abilities are not fully developed. Malnutrition in infancy and childhood will lead to stunted growth, and it will be manifested in the form of PEM, which you are all conversant with the PEM, protein energy malnutrition, and marasmus. Marasmus is deficiency of calories, sufficient calories. PEM means protein energy malnutrition. Both energy and protein are deficient. They will be manifested in different forms. And deficiency of vitamins and minerals will also give rise to specific malnutrition. Then how to prevent the infections in the early childhood? With appropriate treatment, the infections should be recognized early and appropriate treatment should be given so to mitigate the malnutrition rates, as infection and malnutrition make vicious circle. Because once infection occurs, it results in malnutrition, that it aggravates the malnutrition. For example, diarrhea, measles, and all they reduce the immunity and leads to malnutrition. Malnutrition further invite the infections. Likewise, the vicious circle goes on. Exclusive breastfeeding, the first 6 months of life is very important preventative step of malnutrition, because first 6 months the child should be fed with breast milk only, through which immunity will be developed in the child. That immunity will last long. Specific nutritional deficiencies. Protein energy malnutrition is one of the specific deficiencies where protein and calorie deficiencies occur. Is common in first year of life, characterized by low birth weight. The mother is malnourished. So how this occurs? Because of the malnutrition of the mother. The girl child, during the early childhood and adolescence, and during the pregnancy period, in the antenatal or postnatal period, if she is not well nourished, she gives rise to low birth weight child. That is one of the causes for this PEM. And it is also characterized by poor growth in children. And there will be high mortality of the children between 12 months to 24 months. Within the age of 2 years, this malnutrition in the form of PEM will be manifested. It is the underlying cause for 30% of deaths in under 5s. In developing world, 34% of the children are stunted because they are low weight for their age, which results from chronic malnutrition and several episodes of infection. Micronutrient malnutrition, deficiency of some micronutrients like vitamin A, calcium, iodine, iron, zinc, etc. will give rise to specific deficiency malnutrition, which will affect the physical development and psychological behavior. Psychological behavior, erratic behavior will be more to the deficiency of certain micronutrients, and they are also susceptible for infections. For example, vitamin A deficiency in childhood will give rise to blindness, xerophthalmia, that is dryness of the eyes, which is common between 6 months to 6 years. Infections are also very common due to lack of vitamin A because it protects the mucous membrane of the respiratory tract, gastrointestinal tract, and elsewhere. Iron deficiency will give rise to anemia, which is more common in the developing countries. India is not an exception. So this gives rise to fatigue. Child will be apathetic, and resistance to infections are lowered. There will be abnormal psychic and physical behavior due to iron deficiency. Zinc deficiency will give rise to growth retardation. There won't be proper growth. That's why in pediatric age group or preschool age group, they recommend Ginkgo drops. So nowadays, of course, in COVID-19 also, Ginkgo is recommended. Now the demand for the Ginkgo which contains vitamins and added with zinc preparations are of more demand in this period. Iodine deficiency will give rise to goiter. There will be swelling at the goiter region in the neck. Criticism is a manifestation of iodine deficiency. The child will be having stunted growth and puffiness of the face and puffy, swelling of the body, and brain damage may occur due to iodine deficiency. It is also responsible for 30,000 stillbirths per year. 120,000 born with mental retardation, stunted growth, deaf and mute, and they may take birth with paralysis, mental dullness and apathy, even though the babies are born healthy. Though the babies are born and seem to be healthy, the iodine deficiency inside the body will be manifested later in the form of mental retardation. Then milestones are delayed because of effect on the brain. Infectious and parasitic diseases are also common in early childhood because they reach everything. They go outside and play, and they put their soiled hands inside the mouth. They don't know the personal hygiene. They touch each and everything and do all the nuisances. That's why parasitic infections are infections and parasitic infestations are very common in the early childhood because you cannot teach them properly, they cannot grasp them whatever you say. After 5 years, they will be able to grasp whatever you say. So these acute diarrheal diseases, respiratory infections like pneumonia, measles, pertussis infection, polio, neonatal tetanus, tuberculosis, diphtheria, all these things are very common. So for all these common diseases, we have got vaccines against the vaccine preventable diseases. But one has to take care of infections in spite of taking vaccines. Several episodes of infections occur each year and they further aggravate malnutrition. Year by year, they are exposed to infections. The malnutrition will also be aggravated, giving rise to stunted growth or wasting. Poor environmental sanitation, scarcity of water, because the water is not properly utilized, not adequate. The parasitic infestations occur like roundworm infestation, hookworm infection, hookworm invasion, amoebiasis, giardiasis, etc. All these parasitic infestations will occur. They will have long-term consequences on the child's health. Accidents and poisoning. There are more important health problems in developed countries. In developing countries, the accidents among the children are very frequent. Accidents at home are very common, like burns, trauma, falls, poisoning, drowning, etc. Because they go and touch the electrical plugs and switches, they go and touch and with the firearms, or they may touch the burning stove. They may sustain trauma with the several objects, or they may fall from the staircase or from the one floor to other floor, poisoning with kerosene and certain drugs which we keep within their reach. They take those drugs or some poison substances or some medication. If they consume unknowingly, they are subjected to poisoning. Drowning is also common if they are not attended and they go to ponds or rivers. Behavioral problems are notable health problems. More than 60,000 children are abandoned each year in India. Abandoned children are present with severe social and health problems. Other factors affecting the health of the children. Maternal health will definitely affect the child's health. The mother is malnourished, she will also give rise to baby with low birth weight. If the mother is pregnant in the adolescent period of less than 18 years, she gives rise to babies of low birth weight. If the elderly woman is pregnant, that means the women more than 35 years, if she is pregnant, she may also give rise to low birth weight child, or some congenital or genetic disorders may occur. If she is multipara, there is less spacing between the children. The children's health will be affected. So thus, the maternal health is of utmost important. That's why the girl child should be taken care of as regards the nutrition is concerned, as regards other parameters of the health are concerned. We have to take care so that the today's healthy girl child will give rise to better children of tomorrow. Family of the child, physical and social family environment will influence the preschool children. And their speech, their personality, their intelligence and cognitive abilities will depend upon the environment, family environment to which they are exposed. That's why low socioeconomic children born in low socioeconomic conditions and poor family environment, and where there are more conflicts between the wife and husband, where there are quarrels in the environment, either in the community or in the whole, that will have an effect on the child's development. Socio-economic circumstances like physical and intellectual development, parents' education, and parents' profession, and their income will also have some influence on the growth and development of the preschool children. The environment. After 1 week of life, the external environment play a major role in the health of the child. Up to 1 week, so everybody takes care of the child after 1 week. So there will be little laxity in the care of the newborn, and he will be exposed to the external air, the food, the water, and all, to which several infections may pass through the child, to which will become a victim. Social support and health care. The availability of good social support and healthcare system in the community is very important for the welfare of the young children, like development of the presses, daycare centers, healthcare system. Healthcare system is to look after this age group, and presses to keep the children of the working parents at one side, where there will be caretaker to look after their needs. So under 5 clinics. So under 5 clinics are the places where the package of services are provided under one roof by the trained nurses. It's a comprehensive health package which includes preventive services, promotive services, curative services. A referral system will be strong, and educational services will also be provided to the children under 5 years. So the large proportion of children are served with the limited resources. It is very economical because there is no doctor, a nurse will be there, and so no provision of a separate department or separate building. It will be run in primary health centers or sub-centers or in the hospital. Under 5 clinic is a typical example of primary health care. It is the health care given as a preventive measure against infections and malnutrition to the children. That's why it is the typical example of primary health care. So these clinics, under 5 clinics, are set up in primary health centers and sub-centers or in the Department of Pediatrics in hospitals. Usually, they are run once in a week, the afternoon session, where all the under 5 children will be brought for their health problems. In the pediatric OPDs of the hospitals, these clinics will be run every day. So what is the importance of these clinics? Why only children under 5 should be taken care of? Because 15% of the India's population belong to under 5 age group. They are nutritionally vulnerable group. They are the future human resources. Their health is very important for the future of the adults of a country. So the emblem of the under 5 clinic will represent, and it will represent all the services. You see, it has got almost 6 triangles. The first triangle is it represents the care in illness. Second triangle represents promotive services. Third one represents the preventive services. Fourth is in the center, which represents the family planning services. The outer triangles, they represent the health education. So everything is comprehensively arranged. The primary objective of under 5 clinic is to provide the comprehensive health care to non-medical persons in an economical way. So what are the functions of under 5 clinic? As you have seen in all the triangles, one is curative services for minor ailments like diarrhea, respiratory infections, or worm infestations, or minor ailments will be treated with appropriate drugs. Promotive services like group monitoring, they will take the weight of the children. They will see the time to time, they will see the weight of the children and height of the children, mid-arm circumference, and all other anthropometric measurements will be taken to note the growth, whether it is properly according to the local standards or ICMR standards in India or world standards in developed countries will be monitored. Health checkups will be done regularly to the children, and any abnormality will be detected and treated early. Weight reporting will be done, and road to health card is given to each child, and any deviation in the growth will be noted. There is no development for consecutively for 3 months. They will mark it and they will find out whether it is due to feeding problems or due to some infection. If it is due to some infection, they will refer and treat it. The growth failure will be suspected and will be recognized, and the treatment will be given. That is promotive services. And preventive services, routine immunization like polio, DPT, hepatitis B, and pneumococcal vaccine, hepatitis B vaccine, all according to the schedule, we will give. Vitamin A prophylaxis started from the 9th month up to 2 years. Every 6 months, they will give 2 lakh units every 6 months. First dose will be given within 1 year, 1 lakh units, international units, and after 1 year, every 6 months, they will give 2 lakh units of vitamin A up to 2 years. It can also be extended up to 5 years. Because anemia is very common in all the developing countries, including India. Iron and folic acid tablets are distributed to all the preschool children, and they will be advised to take once in a day. This contains 20 milligram of elemental iron and 100 micrograms of folic acid, which will counteract the anemia, and there will be proper neurological development. Family planning, it is the central triangle. Because it is kept in the central triangle, because it is the center of the concern for not only the health of the baby, but also the entire family. Because for under 5 clinics, the children are brought by the guardians or the parents. Usually mother accompanies the child. So all these advices will be given to the mother. The spacing advices or the family planning advices will be given. The mothers will be addressed properly so that they will be properly convinced of the advantage of adopting small family norms and take care of the children properly. so that the child will grow healthily, the mortalities will be less, and status of the community will be reflected to the healthy children. Outermost triangle represents the health education. So what health education they will do? Health education to the mothers regarding mothers, parents or guardians, whoever attend the under 5 trainings. They will be given all the steps of health education, all the steps in health education, how to take child care regarding his personal hygiene, regarding his food, the nutrition, and all, and regarding training and all. Child's growth will be monitored. How to measure the growth of the child. It should be monitored. They will be advised to bring the child to the clinic periodically so that they will see the weight, height, and circumference, such as oral rehydration therapy. At the time of suffering with diarrhea, they will advise how to prepare the oral rehydration solution, how to feed them. All these advices will be given to the mother. Breastfeeding, how to breastfeed the child. What is the proper way of breastfeeding? How much period should be given? And immunization, what are the vaccines they are going to give, for what purpose they are going to do, when they have to bring to the clinic for immunization. All these things will be taught to the mothers. To take personal hygiene methods, like personal hygiene, like from head to toe, care of the head, care of the eyes, oral hygiene, care of the ENT examination, and any abnormality will be attended. Family planning advises, what are the spacing methods, how much spacing should be given, after how many children they have to limit their family, small family norms, etc. will be explained to them. For all these things, female literacy is a must. Unless females are educated, they don't take into mind, their attitude won't change. So attitudinal change is more important. And they will see the other children, how they are doing, and there will be conflict atmosphere as regard the health-seeking behavior of the others. So, in summary, the preschool children are very important age group. Low birth weight is also very important health problem in our country, which results due to for not taking adequate steps at appropriate time. The prevalence of undernutrition in India is very common, but due to proper measures which are taken from 1990 onwards, the mortality is reduced globally. Under 5 mortality is reduced from 93 per 1,000 live births. Under 5 mortality per 1,000 live births reduced from 93 in 1990 to 39 in 2017. That is global figure. From 93 to 39 it is reduced. In India, the under 5 mortality is reduced from 45 in the year 2014 to 39 in the year 2016. These are all due to proper measures taken to reduce the stunting, wasting, and undernutrition. So, in a nutshell, the preschool age group is very important. Is one should take care of mothers should especially take care of their children so that health-seeking behavior, the healthy condition should start from the childhood. Particularly for the girl child, it is most important because they become, tomorrow they will become school age group children. Then adolescent period is very important for the growth and development of the reproductive system, for the reproductive health activities, and reproductive health should be taken care of. Then only they will give rise to healthy children. Well, thank you very much. So the preschool children should play, grow together. వీడియో ఆఫ్ చేస్తాను తర్వాత రికార్డింగ్ అవుతుంది అంతేనా
ఏ వీడియో ఆఫ్ చేస్తారు
కింద వీడియో కలిపి వీడియో ఆఫ్ చేస్తాను తర్వాత వీడియో